Angelman syndrome by Kinsley Scamaldo and Laura Konovalov. What is it? Angelman syndrome is defined as a neurogenetic disorder characterized by intellectual and developmental delay, sleep disturbances, seizures, jerky movements, as in hand flopping, frequent laughter or smiling, and usually a happy demeanor. People with this syndrome are sometimes known as angels, both because of the syndrome's name and because of their youthful, happy appearance. Some history behind the syndrome. It was first described and named after Dr. Harry Angelman in England in 1965, and the first diagnoses in America were made in the 1980s. The syndrome displays a prevalence of 1 in 10,000 to 1 in 20,000 births, and most patients are of Caucasian descent. What are the causes of Angelman syndrome? It occurs due to imprinting or silencing of paternal genes on chromosome 15 with maternal deletion or inactivation of the same gene. So basically, the maternal gene is damaged but expressed, and the paternal gene is being completely silenced. This is similar to Prader-Willi syndrome, which instead loses the paternal genes and has maternal imprinting. What are the symptoms? Characteristic Angelman syndrome signs and symptoms would include developmental delays, such as the lack of crawling or babbling around 6 to 12 months, and intellectual disability, the lack of or minimal speech, the inability to walk, move, or balance well, also known as ataxia, trembling movement of the arms and legs, frequent smiling and laughter, as well as a happy, excitable personality. People who have Angelman syndrome may also experience some more severe symptoms and signs, including seizures, usually beginning between the ages of 2 and 3, stiff or jerky movements, a small head size with a flatness in the back of the head, strabismus or crossing of the eyes, tongue thrusting, walking with their arms up in the air, and hypopigmentation of the hair, skin, and eyes. And these are just some photos of patients with Angelman syndrome and what they would look like. Obviously, the two photos on the left are of younger children, the happy demeanor, smiling and laughing, and the gentleman on the right is a little bit older but still has a very youthful look and as well happy and smiling again. So how do you go about diagnosing this syndrome? A history of delayed motor milestones, and then later in life a delay in general development, especially that of speech. Unusual movements, including the fine tremors, jerky limb movements, hand flopping, and the wide-based, stiff-legged gait. The characteristic facial appearance is not in all patients. They sometimes have a history of epilepsy and an abnormal EEG tracing, a happy disposition with frequent laughter, as stated before, and that deletion or inactivity on chromosome 15 by array comparative genomic hybridization or by BACs on Beads technology. A diagnostic criteria for the disorder was initially established in 1995 in collaboration with the Angelman Syndrome Foundation. Also, the EEG in Angelman syndrome is usually very abnormal, more abnormal than clinically expected. And confirming a diagnosis of Angelman syndrome requires taking a blood sample from the child for these genetic testings. A combination of genetic tests can reveal the chromosome defects related to the syndrome. So is there a treatment? There is no specific therapy for Angelman syndrome, but there is medical therapy for seizures, and it is usually necessary. Physical and occupational therapies, communication therapy, and behavioral therapies are important in allowing the individual with Angelman syndrome to reach their maximum developmental potential. So what about the prognosis? Most individuals with Angelman syndrome will have severe developmental delays, speech limitations, and motor difficulties. However, individuals with this syndrome can have normal lifespans and generally do not show developmental regression as they age. An early diagnosis and tailored interventions and therapies will help improve their quality of life. The clinical features of the syndrome alter with age. As adulthood approaches, the hyperactivity and poor sleep patterns improve. The seizures, if they were present, decrease in frequency and often cease altogether, and the ECG abnormalities are less obvious. Medication is typically advisable to those with seizure disorders. The facial features remain recognizable, but many adults with Angelman syndrome look remarkably youthful for their age, as I stated before in the photo. Puberty and menstruation begin at around the average age. Sexual development is thought to be unaffected, and this is evidenced by a single reported case of a woman with Angelman syndrome conceiving a female child who also had Angelman syndrome. So in conclusion, the National Institute of Neurological Disorders and Stroke supports and conducts research on neurogenetic disorders such as Angelman syndrome to develop techniques to diagnose, treat, prevent, and ultimately cure these patients. Thank you for watching our Prezi, and these are some of our sources.